today's topic is more relevant towards the mental illness, psychological and psychiatric symptoms, which I would like to address to all of you today. But Pancha Mahabhutas are there, because when we look at about your syllabi, your credits, modules, so there is a 5-element concept is there. Under that, all the personality disorders, right, related to the internal dragons, external dragons, and the evil points or the ghost points or spirit points or devil points, all are communicating here. So now all are connected to the neurological disturbances, or we call as a National Institute of Mental Health and Neurosciences, NIMHANS. Patients for the acute problems or subacute and chronic diseases accept the invasive method of the treatments. So we can able to handle here by activating very few points. But I wanted to address you related to the internal and external dragons and then ghost points is the today's topic. If the time permits, definitely I wanted to give you the topmost 12 important spirit points also, spirit locations. But before stepping into that principles, we would like to know what is Shen, what is spirits, what is spiritual, what is entity, what is possession, what is OCD, what is the personality disorders, what are the borderline personality disorders, what is the anti-personality disorders, what are the obsessive compulsive personality disorders, right? So all are connected to the bipolar disorders. I'm really feel uncomfortable situation when we look at about today's generation. You look at about the school children, college students, or the adult age, teenagers, adolescents, and even at the age of 70 years. The people are suffering for this kind of the OCD disorders. Why is it so? Why there is hypersensitiveness? Why there is a mania? Why there is a overexcitement? Why is it so? Is the depression, anxiety, agitation? Today for the day-to-day clinical practice, the people are suffering more and more related to this kind of the disorders. So really this is a very pathetic situation. People could not able to focus their studies, cannot focus their thinking capacity. All the things are rubbish, things are coming to the mind to disturb their thoughts. The rational, irrational thoughts are coming, negative thoughts are coming. They have the ambition to come up that because of certain thoughts are killing themselves to bring them to suicidal symptoms at last eventually. Why is it so? Where the disturbance is going on? Sometimes I feel ourself is the reason to cause the various psychosomatic diseases, psychiatric diseases. No doubt sometimes we need to go and approach to psychiatric doctor in order to get relief of the certain emotions. But how many emotions we do have? There are 7 emotions. Namely, fear, grief, sorrow, sadness, anxiety, anger, rage, resentment, frustration, so on. Majorly there are the 7 categories of the emotions. Those emotions are badly existing in our body. That means Shen. Shen is the soul, spirit. That is existing, that should be exist. Otherwise there is no sympathy, there is no empathy. But over anything called as a mania, excitement, when there is totally nothing, the person he never smile in his life, that also causes the illness. You understand the hypo emotions, hyper emotions, both will reflect to the human system, both will reflect to the internal organs precisely. There is a normal Shen is there that is regulating to the cardiac system. When Shen is affecting to the liver system, that's called as a Hun. When the Shen is affecting to the lungs, that's called as a Po. When the Shen is affecting to the spleen, that's called as a E, Y-I. When the Shen is affecting to the kidney system, that's called as a CZHI. When it is the hyper that flares up our anger, irritation, resentment, so on. The Shen should be very calm, polite, gentle, generosity. That get excitement. For instance, the person Shen is related to the heart. When the heart is good, our Shen and spirit is always is good. Our thoughtful, our memory is always is good. We talk very politely. We don't, work irrational level. We don't get irritation, frustration. When the spirit goes hyper level, the person get insomnia. Only one insomnia leads to the hundreds of diseases. Remember, this is also very important key. The person who don't sleep for 10 days for the day and night, that is the terminal of his life, end of the life. Yes or no?
Yes, sir.
ಇಲ್ಲ ಸರ್, ಒಂದು ತಿಂಗಳಿಂದ ಅವನು ಮಲ್ಕೊತಾ ಇಲ್ಲ, ಒಂದು ವರ್ಷದಿಂದ ನಿದ್ದೆನೇ ಬರ್ತಾ ಇಲ್ಲ ಅವನಿಗೆ, ಏನು ಸರ್ 10 ದಿವಸ ಹಾಕಿದ್ರೆ ನೀವು ತೀರೋಗ್ಬಿಡ್ತೀರಾ ಅಂದ್ಬಿಟ್ಟು ಹೇಳ್ತೀರಾ. ಹೌ ಇಸ್ ಇಟ್ ಪಾಸಿಬಲ್? ಐ ಆಮ್ ಟೆಲ್ಲಿಂಗ್ ಯು, in the day also no sleep, night also no sleep. He never slept for 10 days, even a single minute. That's the termination of the life. When the person sleeps for 1 hour in a day, that also he sleeps. I mean to say, when the Shen to be regulated, that means the entire system of the body, that should be equilibrium of the thermodynamic in our body. Who will going to take care of the thermodynamic? Yes, the heat and cold balance should be precisely there. If it is over temperature, that also leads to the insomnia. When the hypotemperature, that leads to the ಸೊಲೆಕೋಚ್ರತಾವಣಿ. ಎಷ್ಟು ಗಂಟೆ ನಿದ್ದೆ ಮಾಡೋದು, ದಡ್ಡನ ಥರ ಮಾಡ್ಕೊಳೋದು, ಎದ್ದೇಳೋ ಅಂತ ಹೇಳ್ತೀವ ಇಲ್ವಾ? ನಾವು ಎಷ್ಟೊತ್ತು ಮಾಡ್ಕೊಬೇಕು ದಿವಸಕ್ಕೆ? ಎಷ್ಟೊತ್ತು?
6 to 7 hours.
6 to 8 hours, right? Oversleep also causes the problem. Oversleep andre hypofunction of the spirit. When the hyperfunction of the spirit to the heart system, that is connecting to the insomnia. Due to that reason, we says that in the clinical acupuncture, Shen Men is the point is located on the heart 7 on the ventral wrist crease, right? And ear Shen Men both together is good point to treat for the insomnia. Why is it so? Because of we are reducing the fire element within the Shen to bring down the Shen, to cool down our temperature. Yes or no? Then, so in the similar way, the Shen is equivalent to each and every organ should be precisely work. When the person who have affected the over Shen to the spleen system, he always having the anxiety, agitation, depression, so on. ಹೌದಾ ಇಲ್ವಾ? Due to that reason, the spleen gets a malfunction. The spleen and pancreas gets a malfunction. The whole abdominal system get disturbances. Our gut get disturbances. Our get disturbances. Mind get disturbances. Our mind get disturbances that leads to the numerous diseases related to the people who are suffering for the diabetes mellitus and hypertension. If the diabetes is affected, abdominal system gets affected, then spleen and pancreas is affected, then diabetes is stepping into in our body. Because of the Shen of the spleen is affected. When that is affected, then definitely that end up with the hypertension also. BP ಜೊತೆಲಿ ಏನು ಬರುತ್ತೆ? ಶುಗರ್ ಬಂದರೆ ಬಿ ಪಿನೂ ಬಂದ್ಬಿಡುತ್ತೆ. ಬಿ ಪಿ ಬಂದರೆ ಏನು ಅಣ್ಣನ ತಮ್ಮನ ಇಲ್ಲ ಹಸ್ಬೆಂಡ್ ಆ್ಯಂಡ್ ವೈಫಾ ಇದೆ? ಬಟ್ ಒಂದು ಬಂದರೆ ಒಂದು ಇನ್ನೊಂದು ಬಂದ್ಬಿಡುತ್ತೆ. ಜೊತೆಲ್ಲೇ ಇರ್ತಾರೆ. ಯಾವಾಗ ಒಂದು ಬರುತ್ತೆ ಅಂತ ಕಾಣಿಸ್ಕೊಂಡಿರುತ್ತೆ, ಒಂದು ಬಂದ್ಬಿಟ್ರೆ ಇನ್ನೊಂದು ಬಂದ್ಬಿಡುತ್ತೆ. ಯಾಕೆ? Why is it so? Spleen and pancreas connected to the alimentary system. When the alimentary system is affected, when the gut is affected, then brain also affected. ಏನೋ ಡಾಕ್ಟ್ರೆ ತುಂಬ ಕೋಪ ಬರ್ತಾಯ್ತಾ ಇಚ್ಛಿತಿಗೆ, ಸ್ವಲ್ಪ ಬಿ ಪಿ ನೋಡಿ. ಜನಗಳು ಬಂದು ಕೇಳ್ತಾರಾ ಕೇಳೋದಿಲ್ವ? ಕೇಳ್ತಾರಾ? ಕೇಳಿದ್ದಾರಾ? ಸರಿ, ಬಿ ಪಿ ಒಂದು 110 70 ಅಂದ್ಬಿಟ್ಟು ಹೇಳ್ತೀವಿ. ಹೌದಾ, ನನಗೆ ಯಾಕೆ ಇಷ್ಟು ಕೋಪ ಬರುತ್ತೆ ಅಂತ ಕೇಳ್ತಾರೆ ಮತ್ತೆ. ಹೌದಾ ಇಲ್ವಾ? ಮತ್ತು 180/100 ಅಂದರೆ ಅದಕ್ಕೆ ಡಾಕ್ಟ್ರೆ ತುಂಬ ಕೋಪ ಇಚ್ಛಿತಿಗೆ, ನನಗೆ ನಿದ್ದೆನೂ ಸರಿಯಾಗಿ ಬರ್ತಾಯಿಲ್ಲ. ಏನೋ ಮನಸ್ಸೆಲ್ಲ ಹೊಡ್ಕೊಂಡು ಬಿಡ್ತಾ ಹೇಳ್ತಾರಿಲ್ವ. ಮತ್ತು ವಾಟ್ ಈಸ್ ಯು ವಿಲ್ ಗೋಯಿಂಗ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಇನ್ ದಿಸ್. ಸೊ ಮೈಂಡ್ ಇಸ್ ಎಫೆಕ್ಟೆಡ್, ದ ಹಾರ್ಟ್ ಈಸ್ ಕನೆಕ್ಟೆಡ್ ಟು ದಿ ಬ್ರೈನ್, ದ ಬ್ರೈನ್ ಆಲ್ಸೋ ಎಫೆಕ್ಟೆಡ್, ಬ್ರೈನ್ ಈಸ್ ಎಫೆಕ್ಟೆಡ್, ಡೆಫಿನೆಟ್ಲಿ ದಟ್ ಲೀಡ್ಸ್ ಟು ದಿ ಹೈಪರ್ಟೆನ್ಷನ್. ಏನು ಸರ್ ಮಾಡಬೇಕು? ಉಷ್ಣ ಜಾಸ್ತಿ ಆಗಿಬಿಟ್ಟಿದೆ ತಲೆಯಲ್ಲಿ, ಹೀಟ್ ಸಿಂಡ್ರೋಮ್ಸ್, ಆಯಿಲ್ ಮಸಾಜ್ ಮಾಡಬೇಕು. ಒಳ್ಳೆಯದು. ಆ ತಕ್ಷಣ ಬಂದು ಅವ್ನು ಸರಿ ಹೋಗ್ಬಿಡುತ್ತೆ, ನಿದ್ದೆ ತುಂಬ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾನೆ. ಅದಾದಮೇಲೆ ಮತ್ತೆ ಜಿಂಜರ್ ಆಯಿಲ್ ಯೂಸ್ ಮಾಡಬೇಕು, ಜಿಂಜಲಿ ಆಯಿಲ್ ಯೂಸ್ ಮಾಡಬೇಕು, ವೀಕ್ಲಿ ಒನ್ಸ್ ಕೂಲ್ ಡೌನ್ ಮಾಡಿಬಿಡುತ್ತೆ. ಮತ್ತು ನಿಮ್ಮ ಯೋಚನೆಗಳು ಕೂಲ್ ಡೌನ್ ಆಗ್ತಾ ಇಲ್ಲ ಅಲ್ವಾ, ಹೈಪರಲ್ಲಿ ಹೋಗ್ತಾ ಇದ್ದೀರಾ ನಿಮ್ಮ ಥಾಟ್ ಪ್ರಾಸೆಸ್. ಹೌ ಟು ಕಂಟ್ರೋಲ್, ಹೌ ಟು ರೆಗ್ಯುಲೇಟ್ ದಿ cerebrospinal fluid, how to be done as a cooling effect to the brain. Remember, all are connected to the thought process. Remember this very important key. Everything take it as a easy level. Anything connected to the harming to your body, then definitely harming to your lifestyle or harming to some activities or protecting or refining to do some kind of the activities, then you understand that's always is good, because you don't know what will going to happen next level. So God has been saved you to going to reaching to that destination or going to work on that level. So anything connected to that, it's not happening, then you yourself you understand that's good for your health and goods for you for the later future. Yes or no? So in this way, definitely we always remember the things. So we should be politely handle the situations timely. But if we get aggressive, that definitely leads to that particular organs. When the Shen is connecting, when the Shen is predominantly affected to the lungs, which we call as a Po. In Chinese, for the lungs system called as a Po, Shen is affected, then you understand the person is suffering for the three symptoms. One is the sorrow, the other one is his sadness, the third one is his worries, disappointment. Right? Then you cross check with them, the person is always in this sentiment. Then you understand which is connected to the lung system. Lungs having the hyperfunction which leads to that problem. The lungs are not influencing to that emotions which causing this kind of the disturbances. When the lungs are affected, the numerous related problems causes. You don't know to express the sign and symptom of the diseases, because always I used to tell each and every organ having the hundreds of the diseases. Do you think the skin is connected to the lungs, so there is a skin problem? Nose is connected to the lungs, therefore the lungs are the portal of the nose, the lungs causing the problem of the nose, right? So intestine is connected to the lungs, it is connecting to that particular issue. But the white color is connected to the lung, anything the white hairs are there related to the lungs, right? When the sadness and worries and grief and connected to the sorrow is connected to the lungs. Of course, apart from that, you don't know anything else. So apart from that, the lungs having the numerous related to the sign and symptoms which is communicating to the only lung system. When you understand about the Western pathological effect, malaria or the pneumonia is connected to the lung system, right? Or the polyps or something connected to the sinusitis or the asthma, anything connected to the pulmonary embolism or pulmonary related diseases are connected to that particular problem. But apart from that, hundreds of the diseases you can connect to the lung system. You look at about the burning sensation is connected to the lung system. Sensory organs or sensory symptoms are connected to the lung system, right? Not only that, when you understand when the person is suffering for the knee pain related to the lungs is connecting to the chest cavity, but the knee pain patient is getting the problem, then you understand it is related to the lungs problem, because of the lungs are not descending direction of the energy is not moving towards the kidney, so which causing the problem of the knee pain. Where is knee pain, where is the lung system? But it is directly indirectly connecting to that particular organ. So as per the 5 element theory, the lungs are communicating. Lungs are mother for the kidney system, grandmother for the wood liver system. Therefore that should pass the energy precisely. That's not passing, that is occupying the energy, which leads to the several diseases. So therefore, when we need to understand about this pathological defect, So here I would like to give you as a key later on when I think the pulse diagnosis already is there in the YouTube channel, you just go through that. But however, the pulse diagnosis majorly, it gives the information related to the which organ is affected, irrespective of the symptom, irrespective of the diseases, your duty to activate and regulate that organ. Now I'll give you one example. Now the lungs are affected, the patient having the shortness of breath or breathlessness and asthma or anything connected to the lungs, you look at the patient, yes, the lungs are affected, right? Then when you understand about the organ level on the pulse diagnosis, when the urinary bladder having the deficiency, that is the reason to cause the asthma. When the gallbladder having the deficiency, that's the reason to cause the asthma. When the gallbladder having the excessiveness, that is the reason to cause the asthma. When the small intestine having the deficiency or excessiveness, which leads to the asthma, right? When the spleen having the deficiency or excessiveness, that causes the asthma. Stomach having the influencing to the asthma. But you understand only that lungs be theek hai, large intestine be theek hai. Then where is the origin to cause the problem? Supply LU9, LU7, LU11, LU5, so on. Normally we think about lungs problem, isko laga do lungs ko. No doubt you just apply the lungs points, also supportive point, like in uska reason is somewhere else. This is the key. You just apply ST44 called as a knee thing. Is the grandson point of the stomach meridian. So that drain out the energy, that passes the energy to the lower geo when the lungs is occupied the maximum energy, not descending downwards direction. So that you are strengthening to the lower geo to receive the energy of the lung system, to receive the energy of the stomach system, because the stomach is stored the excessive energy in the fundus of the stomach, and that's not descending downwards direction. Repellence of the chi of the stomach is moving upward direction, which flares up the asthma. Due to that reason, you understand in the extreme level I wanted to tell you. As per the organ clock theory, what is the organ clock timings of the lungs and then urinary bladder? What is UB timings? What is the physiology of the stomach 44? Stomach 44 is equal to UB 40, Wei Chung. So UB40 is the grandmother point, ST44 is the grandson point. Strengthening to the urinary bladder. See how gently, if you understand about the pathology, the stomach is stored the energy, not descending. You applied the ST44 to descend the stomach energy. ಊಟ ನಾವು ಮಾಡ್ತೀವಿ, ಎಷ್ಟು ಗಂಟೆ ಇರಬೇಕು ಹೊಟ್ಟೆಯಲ್ಲಿ? ಜಾಸ್ತಿ ಅಂದರೆ 4 ಗಂಟೆ. ಅದಾದಮೇಲೆ ಅದು ಟ್ರಾನ್ಸ್ಫಾರ್ಮೇಷನ್ ಆಗಬೇಕು. ಅದು ಹಾಗಿಲ್ಲ, ತುಂಬ್ಕೊಂಡ್ಬಿಟ್ಟಿದೆ, ನಡೆದ್ರೆ ಉಪ್ಸ, ಹೌದಾ ಇಲ್ವಾ? ಬಿಕಾಸ್ ಹಸಿವು ಅನ್ನೋದು ಏನು ಅನ್ನೋದು ಅರ್ಥ ಆಗ್ತಾ ಇಲ್ಲ ಅವ್ರಿಗೆ. ಟೈಮ್ ಹಾಕಿದ್ರೆ ತಿನ್ಕೊಂಡ್ಬಿಡ್ತಾರೆ. ಬಟ್ ದಟ್ ಈಸ್ ಸ್ಟೋರಿಂಗ್, ರಿಟೆನ್ಷನ್ ಈಸ್ ಮೋರ್. So what you will going to do, stomach 45, stomach 44, you are dredging out the energy from the stomach to descend the energy to move on to the intestine, to move on to the urinary bladder. Intestine ಹೋಗುತ್ತೆ energy ಅಂದರೆ the feces, defecation, stool ಜೊತೆಲಿ ಅದು ಫ್ಲಮ್ ಹೋಗ್ಬಿಡುತ್ತೆ. The ST44 you are strengthening to the urinary bladder through the urine, urethra, urine ಜೊತೆಲಿ ನಿಮಗೆ ಟಾಕ್ಸಿನೇಟೆಡ್ ಹೋಗ್ಬಿಡುತ್ತೆ. Bladder also got emptiness, stomach also got emptiness, and then intestine also got emptiness. Then the patient feel hungry, the patient feel more comfortable on the diaphragm muscles. When the diaphragm is good, the lungs expansion and contraction is good. The dilatation of the heart and contraction of the heart also good.